Learning your baby's cues is important for safe and positive feeds. Here are some tips to learn how to safely feed your NICU baby. First, we want to observe your baby alerting and showing hunger cues such as bringing hands to mouth, rooting on the blanket, or smacking lips. If your baby does not wake up and show hunger cues, we do not want to push the baby to bottle feed. This can lead to a negative and/or unsafe feeding experience. Babies may choke if they are too sleepy to eat. If your baby does wake with cares and shows hunger cues, swaddle your baby and take them out of bed. Swaddling helps your baby maintain a good position for feeding. Ideally, swaddle baby with hands near the face and legs flexed. Next, you are going to position your baby in side lying. Make sure your baby's head, neck, and body are aligned and fully supported. Think ears over shoulders over hips. This position may feel uncomfortable at first, but side lying helps your baby have more control over the flow of milk and can also help with maintaining alertness. Baby can draw milk out of the nipple at a more comfortable rate rather than the milk dripping in. This also replicates a breastfeeding position and makes breathing easier. In addition, if there is too much to manage, the milk can spill out of the side of their mouth rather than going to the back of his or her throat. Here, we will show you 3 different side lying positions. The first being traditional elevated side lying with the baby out, away from your body, supporting with your non-dominant hand and forearm. The second position is a football hold with your baby tucked under your arm with a pillow for support. The third option is holding your baby turned towards you parallel with your body. Next, offer your baby the bottle by brushing their lips. If your baby opens his or her mouth, place the nipple over the tongue. It is okay to put the whole nipple in their mouth. Avoid forcing the nipple in baby's mouth. Baby may need a few minutes to settle and organize after being taken out of bed. Once your baby starts to suck, observe his or her suck-swallow-breathe pattern. Some babies may suck too many times before stopping to take a breath. If your baby drinks too quickly, they may need a slower nipple or pacing. To pace your baby, very slightly tilt the bottle down. Wait until your baby has taken several breaths before allowing your baby to suck again. Monitor your baby's suck-swallow-breathe coordination while he or she eats. Swallows should be quiet and your baby should look relaxed. If your baby is showing signs of stress, provide a rest break or stop the feeding. Stress signs include coughing or choking, dropping oxygen saturations or heart rate, becoming blue around the eyes or lips, and stopping breathing. Some signs you might notice before one of these events occur include hard, gulping swallows, excessive milk spilling from the mouth, raised eyebrows, pulling away from the bottle, breathing harder and faster, stunned blinking, and a decrease in muscle tone or becoming limp. Avoid excessive measures to coax your baby to keep eating, as your baby should always be allowed to decide to eat and have a positive experience. To burp your baby, you can sit them up in your lap. Support their upper body and head while leaning them slightly forward. Provide firm, gentle patting as well as upward back rubs. Your baby may or may not burp. To know when to burp, look for signs such as losing latch on nipple, slowed feeding, or falling asleep. Remember that feeding is very hard work for your baby and is often the most challenging part of the NICU for families. The more practice you have feeding your baby, the more comfortable you will become in understanding his or her cues. Always feel free to ask your baby's nurse or feeding therapist if you need support.